Hello, everyone. Thank you for joining us today. My name is Lydia Walagorski, and I have the honor of being the Public Policy Director for the Colorado Coalition Against Domestic Violence. We want to talk to you today about a new law in Colorado that strengthens privacy, confidentiality, and safety protections for domestic violence and sex assault survivors. And I want to share some information with you in this webinar. We are gearing this webinar today primarily towards medical professionals and medical licensees, but certainly the information is also of interest to social workers, advocates, therapists, anyone working with a survivor to help them navigate privacy and confidentiality related to safety planning. So I want you to know there's additional information regarding this law, which is House Bill 1322, on the CCADV website, but you can also seek guidance from your hospital legal policies and your legal department if applicable. So our goal today is to give you clear and concise information regarding the change to the law and walk you through the new requirements for documenting domestic violence in medical files. So first off, I want to talk just a little bit about how we got here and why there was a need to change the law. So the current law, because this bill won't take effect until August 9th of 2017, was absolutely well-intentioned and had been in place for a little over 20 years. And about 11 years ago, the coalition started hearing from survivors and advocates that the law was producing some unintended consequences for survivors, and the coalition staff around that time published a white paper looking at the pros and cons of mandatory reporting for healthcare providers, where we legally required healthcare providers to call law enforcement if they were treating injuries resulting from domestic violence over the wishes of their patients. And so we heard from survivors who had felt like they had to lie to their physicians because they felt like the police could not fully protect them or their kids from their abusers if they were to make a report. We heard from doctors and nurses who had made the decision to not call law enforcement because they believed their patient when they heard them say, "I will be in more danger if the police come to my house because I'm not ready to leave yet." And we heard from providers and advocates in parts of the state that said they were not aware of this law and were not calling law enforcement. And so we had a lot of really unequal implementation around the state. We had a lot of misperceptions about what was expected of medical providers and what survivors could expect in terms of privacy. Add to this that under the Affordable Care Act, domestic violence screening was now 100% covered benefit. And so we saw a move towards universal screening for domestic violence. And that caused all sorts of misunderstandings around, do I have to report what is told to me? Do I not have to report? For survivors who were undocumented or are undocumented, or if survivors had had prior incidences with law enforcement or poor outcomes from the criminal justice system, we were seeing them forego primary care and forego primary screening for things like breast cancer and cervical cancer and all of the necessary screenings for fear of letting the secret out. And so we got to a point where the unintended consequences were outweighing a perceived benefit. And so we started talking to medical professionals, survivors, and we really compared the rates between the states that did require this mandatory reporting and the other 47 states that did not require this mandatory reporting. And we realized that the unintended consequences were a little bit higher than what we were seeing in terms of a perceived benefit from this well-meaning law. So we worked with the state legislators last year, and House Bill 1322 was born. So after August 8th, so on August 9th, medical licensees are no longer required to report domestic violence if the patient is 18 years old or older and wishes not to report. So we're going to talk through in this PowerPoint all the nuances and all the caveats of that, but the bottom line is that an incident of domestic violence is not the sole trigger point for someone to have to report to law enforcement injuries. And so the backbone of this bill is absolutely patient confidentiality. And we know that this patient confidentiality for domestic violence survivors can equate into safety. A safety plan is great as long as the abuser does not know what the survivor is going to do next, right? And on that note, we need to provide a word or two about safety planning and leaving a relationship as needed context to really best understand the goals of the new law. The organized response to domestic violence and sex assault in America is really relatively new compared to the practice of medicine, right? And for the longest time, the loudest response to someone disclosing an act of domestic violence was to tell that person to just leave a situation, right? And so why don't you just leave is continually a question that a survivor has to ask themselves, right? Or has to answer the public and people around them generally. And so, we know that in a perfect world, if we could wave a magic wand and give each adult and child survivor a safe and long-term home to live in, if we could keep the batterer away from them and the kids indefinitely and provide for their ongoing financial stability, only then is the question of why don't you just leave a fair question, right? Until we can do that, we have to understand that leaving can be a long and complicated process. Okay. So when we talk about leaving, okay, there's a couple of things and myths that we really want to take a moment of. And if there's one thing you learn from any domestic violence training that you go to, it's that leaving is a process, right? So leaving can take time. Survivors may need time to consult an attorney. They may need to save up money so they do not become homeless. There is often overwhelming psychological and physical trauma, and they may fear for their lives or for their children's lives. There may not be a safe place to go, and they may not have finances together yet. We also know that as a batterer loses control in the relationship, as the patient, victim, survivor asserts options to leave and starts to distance themselves from the relationship, this can and does often cause an escalation of the physical or sexual violence from the batterer towards the victim. Numerous studies tell us that the two most dangerous times for a survivor is when a woman is pregnant and right after they leave the relationship. And so forcing a survivor to leave without an exit strategy or safety plan, such as the medical mandated reporting law did before this change, can result in more danger for the survivor patient. We know from the well-documented work of Dr. Jacqueline Campbell and others that physical separation plus legal separation is when the majority of domestic violence homicides occur. And that's over 70% of the homicides from domestic violence occur after someone has ended the relationship. We also know from Dr. Campbell's work there are a small percentage of domestic violence homicides where there was no prior physical violence before the homicide. With these two factors in play, we have come to understand over the 40 years of the violence against women movement that listening to survivors is critical. The victim, survivor, or patient is the best source of information about their own life and their own risk factors. Working with them, listening to their needs, yields safer outcomes rather than limiting their decisions and options. So as we work with survivors and we listen to their assessment of their own risks, and we know that these well-researched consequences and decisions are absolutely the premise behind the mechanics of the new law in Colorado. So these were our goals when we set out to do this bill. So one, we wanted to allow medical professionals to respect the patient's wishes regarding contacting law enforcement, right? We wanted to provide self-autonomy and trauma-informed choices for survivors, and we wanted to restore professional discretion for medical licensees, right? So this bill recognizes the complicated safety needs for domestic violence survivors. For the rest of the presentation, we're going to dive deeper into the specifics of this bill and talk about how House Bill 1322 interacts with other mandated reporting laws and other protections for patients who have experienced sexual and domestic violence. Okay. So you have, as a medical licensee, after August 8th, on August 9th, you will have professional discretion restored back to you, right? And so if the survivor requests for you to not contact law enforcement, you can choose not to report, and you have professional and personal immunity on both sides. You have immunity if you do report. You have immunity if you do not report. So it really lies with you in terms of your discretion, in terms of whether or not you feel like you can support the survivor in respecting their wishes for safety and confidentiality, or if you feel like there's something about this case situation where I just don't feel comfortable not calling law enforcement. So it is up to you, and we worked very closely with medical professionals during the stakeholder process at the Capitol to get to this conclusion, that there needed to be professional discretion here. So if you do choose to report, you must confidentially notify the survivor of your intention to call law enforcement before you make the report and the call. So if you say, there's something about the situation that I don't feel comfortable not calling law enforcement about, you can call law enforcement and you have immunity to do so. However, you must take the survivor aside and say, I'm going to call law enforcement and let them know that that is happening, okay? So we know that overall, this law allows you to work with your patient and not against their wishes for confidentiality, safety, and privacy. And so having conversations with your patients in terms of what their safety plans are, referring them to a confidential advocate, and getting to know kind of where they're coming from in that decision not to report can help you sort through this. And so, of course, knowing that you have discretion to report or not to report, the next question is, when do I report? So for reporting, all child abuse is still absolutely reportable. House Bill 1322 does not touch the child abuse reporting statute at all, and so that is always reportable. If you have a patient that is over the age of 67 and you need to consider reporting elder abuse, you can still do that. This law did not impact elder abuse per se, but domestic violence is not the sole factor to determine whether or not you need to make a report of elder abuse. Okay, if the patient is living with an intellectual or developmental disability or is otherwise not legally able to make their own medical decisions, that's still a case when you can report. As a medical professional, you can expect a good number of your patients have experienced domestic violence or sex assault at some point. And we know that there can be long-term physical and mental health consequences for survivors. And now that there are once again reporting options for you and survivors, you can freely talk to and screen your patients about what is going on in their lives and their health histories without fear of placing the patient in harm's way. So, universal screening can be a great tool in terms of you as a physician being able to support your patient and knowing what's going on for them and knowing what their risk and protective factors are. And so with this law, you are able to do that freely without having to be forced into a situation where you have to call law enforcement. Okay. So also, when do you report? If the patient has experienced an incident that would meet the definition of serious bodily injury. Okay. As a medical licensee, I'm sure you are very familiar with serious bodily injury. We have it for you on another slide, and we have it certainly as resources if you need to refresh yourself with that actual Colorado statute. But for any cases that you would sign off on and document as an act of serious bodily injury, that is absolutely a report to be made. Under existing law, if a patient has been shot or stabbed, as outlined in the current practice in law, then you still have to report that. Dangerous dog bite, you still have to report. It didn't change any of the reporting requirements other than it took out the impetus for domestic violence to be the reason why you were reporting. And so we have a table here that will walk you through this. This is available to you on our website. It's going to stay up there on the website, and so you can always take a look at that. And so sexual assault has not changed. It is always at the patient's discretion. Domestic violence is at the licensee's discretion, and then we always report serious bodily injury, gunshot wounds, child abuse, injuries to vulnerable adults, and injuries resulting from criminal acts other than domestic violence and sexual assault. So under House Bill 1322, in some ways it was not a full repeal of mandated reporting because you are required to make referral to a confidential victims advocate. So either way, if you choose to report to law enforcement, you have to also call and make a referral to a confidential victims advocate. If you choose not to report, you have to make a referral. So the goal is still to get a survivor immediate access to resources. And so the best practice is to encourage a survivor to call a confidential advocate directly from the privacy of the exam room. Once a survivor has disclosed to you and you are seen as a supportive person, you can say to them in a very trauma-informed way, right, in terms of, thank you so much for trusting me with your story. I know feeling safe again can be complicated, and we may not be able to solve everything for you tonight. We can call a program together and get you hooked up with professionals that can help you navigate the next steps, right? And you can call together. All of the services from community-based advocacy programs, by law, have to be free and confidential. And so you can call the local domestic violence program or the national hotline. The national hotline has access to over 200 languages, and they will route to direct you to the nearest domestic violence program that can provide services. And so I know, especially in our rural communities, a lot of our physicians are traveling to work there, some odd hours and shifts, and so you may not be familiar with your local domestic violence program. And so you can always call the national hotline and ask them to send you to the local program, and they will do that. Services from confidential community-based advocacy programs are absolutely not limited to emergency shelter. Advocates can help safety plan. They can provide ongoing counseling regardless of if someone has left or not left the situation. They can provide legal advocacy. They can provide children's advocacy. And most programs can provide an immediate response. And so while not every program has the capacity to respond in person to the emergency department, our programs accept new clients 24 hours a day, 7 days a week, and provide advocacy 24/7. The phone call is simply the first step. Just like you wouldn't knock on the door of a confidential shelter and be expected to be let in at that point, that phone call has always been that first step to access services, and it still is. So helping somebody make that call from the safety of the exam room is really the best practice that we're looking for. So for documentation on this, in terms of what am I required to write in the medical file, and keeping, the first rule of documentation has always been if it's not written down, it doesn't happen, right? You're taught that from day one. And with this, the medical file can be accessed by the survivor anytime going forward. Under limited circumstances, the courts can issue a subpoena for the medical file, and so we want to make sure that there's good documentation so that if a survivor does get to a point where they want to go forward in either a civil action, they want to prove the best interest of the child in terms of documenting there was domestic violence in that situation, they want to go forward with a criminal prosecution, then that is retained in the medical file that they have access to. And so if you choose not to call law enforcement, you have to document what you observed in terms of what injuries you observed, as you normally would and have always done. You're asked to say, what you heard from the patient in terms of documenting their specific request not to call law enforcement. And you should document that you provided a referral to a confidential advocate. Okay, so that's if you are not calling law enforcement. Okay, so if you are calling law enforcement, the only thing that you that you put into the file is just what you observed, right? And so you don't have to give additional information under HIPAA. You only write what you observed, right? You document that you confidentially informed the victim that you decided to call law enforcement, and you document that you made a referral to a confidential advocate. So this chart also lives on our website, and so that can be available for you. There are a few caveats and few nuances of how this latest law in Colorado will intersect with existing laws on mandated reporting for sexual assault survivors. And so we have just a second to go through those. So for our SANE nurses and for folks that do sex assault nursing or forensic nursing, you will know that sexual assault survivors have had reporting options in Colorado for a few years now. You may also know that people could report anonymously or do a medical-only report up until the time that they disclosed that the person that had assaulted them was a dating partner or other intimate partner. So House Bill 1322 closes that loophole for sexual assault survivors, and so it allows sex assault survivors to truly have choice and autonomy in terms of whether or not law enforcement is called related to their case. And so it's something to be aware of. And we have a link here and a link on our website to a living document that is a product of the Forensic Compliance Evaluation Project that will list out all the nuances and all of the reporting options for both sexual assault and domestic violence survivors. We also promised to give you some additional reminders about what serious bodily injury is in Colorado, and so we've included that in the slide. And then we also know that you might have some questions around the professional and personal immunity under House Bill 1322, and so we've included the actual language from the bill in this. And so I know this is a very wordy slide, but we know that this is something that you may have questions on. So all of the new language is in all caps, and the existing language is in lowercase, and that's just how we do statutes in Colorado. So you can certainly read through this. And a fun backstory, just to prove how deep this immunity is that before this bill was introduced in the House, leadership would not let us introduce it until the trial lawyers had signed off on it, that this was actually good immunity. And so the trial lawyers signed off after some great debate, and we're actually on the same side as everybody on the immunity. So we do think that it is good, and we worked very closely with the Colorado Association of Family Physicians to work on this bill. So the trial lawyers and the malpractice team both agreed, both signed off, you have good immunity. So again, if you have any questions, contact your hospital legal counsel, but there it is for you to share with them. So thank you so much for your time today. We are available to you for free technical assistance on House Bill 1322. If you want an in-person training or you want us to come out and do more, there may be some mileage fees that we have to take care of, but other than that, you are always welcome to call us. You are always welcome to call or email any of your technical assistance questions you have about this bill. We've attached some links for you. The first one is the actual bill language that passed, and so you can read through and pour through that. The link to the full manual for the Forensic Compliance Evaluation Project, and then also we know that while this bill was in place and while the current law is in place in 3 different states, there are also some unintended consequences for our undocumented survivors for this. And so there was a very recent op-ed in the Los Angeles Times that talks about how medical mandated reporting interacts with immigration right now. And so because it is so timely, we included it as a link for you to look at. So again, please feel free to contact us with any questions you might have about this. Thank you so much for the great work that you do every day. Thank you for supporting domestic violence survivors, and we look forward to hearing from you soon.